Now, Ellie, how to give a report is an art. It's an art. It's really tricky. And basically, let me give you some advice. It's going to take 500 times for you to screw it up and sound like an idiot before you get good at it. Welcome to the game. Now, I will suggest this. When you're calling a consultant and they know you're new, it's like a shark smelling blood and they're going to give you shit. Okay, welcome to the game. Now, the bottom line is you want a good relationship, you want to be honest and transparent. You have to have the hospitalist feel like you're working really hard. They have to look at you as a young clinician who's a super hard worker, very thorough, and then they'll give you a little bit of grace. Okay, but they're going to give you pushback. Nobody wants a call from you because you're giving them 30 to 45 minutes of work. Now, a bit of advice I would give you is number one, whenever you call a hospitalist, you start the conversation with sorry to bother you. It's called reverse concessions. A lot of times hospitals are like, I can't believe a PA is calling me. I'm sorry for bothering you. I'm sorry for this. Which basically you're kind of apologizing for the hierarchy. Just know it greases the wheels a little bit, gives you a little leverage with influence. Number two is start with your assessment and plan. Hey doc, sorry to bother you. Hey listen, I got a 56-year-old with chest pain. I need to get admitted to telemetry. So your assessment is chest pain, plan is they're coming in. When you start that way, there's no negotiation. I'm not negotiating with you, they're coming in. And it gets rid of some of the pushback. Tone of voice, how you frame it is relevant. Okay, when I used to call a surgeon, hey doc, listen, I got a guy with appendicitis. I think he's got appendicitis. I need to evaluate him. Okay, when you kind of give it that way, when I say, doc, listen, I got a guy with lower quadrant pain. I need a surgical evaluation. When can you see him? So how you frame it does help. So when you are giving your sign outs, please make sure you have all your ducks in a row. And that takes even preparing paperwork on your desk. Let me give you a warning. If you're talking to anybody who this may end up in surgery, anybody, you better know if they're on anticoagulants or antiplatelets. You better have that on the tip of your tongue. So hopefully these are some pearls to help you, but just know it's going to take, it's like when I teach someone fly fishing. I'm going to say, listen, you're going to get caught on the back tree. You're going to get knots 500 times before you get some degree of flow. Even now, I've been doing 26 years. I've admitted thousands of patients. Every once in a while now I sound like a buffoon. Welcome to the game. It just happens sometimes. Good luck. God bless.